as we go. I have a few slides underway as well where we can just take up things as they come. So I'm going to let the recording start and just wait 30 seconds. So my name's Heather Ames, as I was introduced. I'm at the Norwegian Institute of Public Health, and I've been working with qualitative evidence synthesis for 9 years now. Time flies. And as part of my PhD, we were doing a QES on parents' decision-making around childhood vaccination and information around childhood vaccination. And that's where we ran into the issue for the first time of having just way too many studies. And so what we know as qualitative researchers, or what we figured we knew, was that too much primary data can threaten the quality of your synthesis. I have the same opinion about primary qualitative research, that if you have a focus group study with 700 participants across 25 focus groups, you're probably not going to be able to do a really sort of in-depth analysis of that data. So we took that viewpoint into my first QES and said, okay, 78 or 82 studies, whatever it was just too much. And we needed to figure out a way to purposively sample studies into our synthesis to make sure that we had a good quality synthesis, but also to make sure that we had studies that were answering our question and studies that would be rich and contribute to our synthesis. We didn't want to just pick studies randomly, which would have been another option. So today I'm going to talk about how to think about sampling, when to think about sampling, different potential ways of sampling. I'm going to present how to build a sampling frame, which is one way of going about sampling. And then we'll just have some discussion. So when you should start thinking about sampling. Often when you are starting your QES, you have an idea that the field is very large or very small. So my most recent QES was on perceptions of treatment for chronic low back pain in people over 60. Then we knew that the field was probably going to be very small. So we didn't really consider much about sampling at the protocol phase. But in areas like HIV or vaccination or other areas where there's a lot of primary studies, already at the protocol phase, you should be considering different ways of sampling, how you want to do your study selection. So we'll come to that as well, theoretical study selection or comprehensive study selection, and what type of sampling would best fit your review question. So that's what we're gonna look at today, and that's what you should think through when you're thinking about sampling. So starting at the protocol phase, already considering reflexivity, of course, is a very important part of your qualitative evidence synthesis, but also a very important part of reflecting on your sampling, because your previous experiences and assumptions can impact how you plan and conduct your sampling. If you've done primary research on the topic, if you have done research in different areas or different geographic locations or different populations, if you have experience with the topic or somebody you know has experience with the topic, the review team should reflect on how these experiences could impact how you choose to sample for your review, and just be aware of those going forward. So, in the upcoming Cochrane QES handbook, there's going to be a lot more on this, but I'm briefly going to touch today on what we mean by theoretical or purposeful study selection versus comprehensive study selection, because this can also impact how you choose to sample for your review. So comprehensive study selection is kind of the gold standard. Well, it is the gold standard for effect reviews, and it's what we in the QES world started out doing and are still doing to some extent. And that is that we identify everything that meets our inclusion criteria at the full text level and then decide if sampling is needed. So we do a comprehensive search, we do a comprehensive study selection down to full text, and then we look at the data we have and say, okay, is this too much? Do we need to sample? So the more traditional way. of doing a systematic review. Whereas when we have theoretical or purposive study selection, this can be an ongoing iterative process with ongoing evaluation from the time you start title and abstract screening. So you may decide to stop screening completely once you've identified enough studies that meet your inclusion criteria and have rich or thick data. You may decide to do rounds of screening and sort of do a synthesis and then do another round of screening synthesis. So there's different theoretical approaches to study selection that are starting to be developed that are different from sort of our initial find everything and then decide if we need to sample. So that's already at the protocol phase, an important decision to make, whether you want to do a comprehensive study selection or a theoretical or more purposeful study selection. So here you can see sort of a typical flowchart through a QES process for study selection. So we search, we deduplicate, and we begin screening. So at this point, you're either going to screen comprehensively or you're going to screen theoretically, which is until you find enough. At some point, you're going to complete your screening. And here you need to decide if you don't have enough data, so you need to expand your inclusion criteria or conduct a new search. If you have an appropriate amount of data so that you can just proceed with your synthesis, or if you have too much data. And then you have two options really with too much data. You can choose to sample, which works in a lot of contexts, or depending on, for example, if it's a commissioned review and the commissioner has certain populations or years or geographic context they're interested in, you could choose to restrict your inclusion criteria. And that would be one way of paring down the number of included studies. So once you've decided how you want to proceed, then you can go ahead with your synthesis. In comprehensive study selection, as I said before, you're really looking to find everything and then decide if you need to sample. And then if you find that you have too much, you have your last little box at the end where you sample and then extract the findings from the sampled articles. Whereas with purposeful or theoretical approach to study selection, it's a much more sort of circular iterative process where you screen, you decide if you need to adjust your screening or your inclusion criteria, you screen your full text, you do a data extraction, and then you decide if you need to sample or not. And if you do, then you do, and if you don't, you go to synthesis, and then maybe you do your data synthesis and you decide you need to do the process again and include more studies. So comprehensive, you go through everything until you have your group of studies, whereas a theoretical or purposeful approach to study selection, it's much more iterative where you're going through a loop. The most common scenario for now, I feel, is still the comprehensive study selection process, especially within Cochrane reviews. So this is where you screen everything down to full text, you find out you have too many studies, and then you need to use a sampling strategy to reduce the number of studies that are included in the synthesis. So all of the studies are still included in your review, but you're sampling studies to be included in the synthesis of the review. And the objective of sampling is to find the studies that will give you the richest synthesis. So to find those studies that will best answer your question with good data. So I think we can have a small chat now. And I wanted to just hear from you guys what factors you think should be considered if you're going to sample from your included studies. So either from personal experience or just what you think. What factors would you be considering when sampling in your review? I'm going to stop sharing so I can see you guys. And I know some of you have done this, so you can always come with your own experiences about what you felt. Yeah, Sarah, go for it. Sarah, you're muted still. I don't know if I have to unmute you or somebody else does.
I think I've unmuted Sarah.
Yes,
There.
can you hear me okay?
Yes.
Yeah.
Brilliant. Yeah, thanks, Heather. As you know, we've drawn on your kind of work around sampling a lot. So just to say for the others, for a recent Cochrane review QES we did around childhood vaccination acceptance, we did a sampling framework that we considered kind of three main factors. So we considered the conceptual richness of the studies. So our methodology, we really wanted kind of rich studies. So we sampled from the studies to only include those that were very rich conceptually. We then said we didn't just want rich studies, but we wanted those that were rich relevant to our synthesis objective, and we drew on your approach with that. So our kind of second criteria was the relevance of our reviews. And then the third criteria we used was geographical spread. So we wanted to include a kind of nice spread across low, middle and high income countries and across WHO regions.
Yeah.
So those were the kind of, that was the approach and the issues we considered for our QES.
Yeah, and you guys had a massive number of studies, so you could really draw on those approaches. Absolutely. So what I hear Sarah saying is very similar to what we would do if it was a primary qualitative research, right, Sarah? You're looking for rich, thick data.
Absolutely.
You're looking for relevance, and you're looking for context. Yeah, different contexts, different populations. Great. Very good. Well, I'm not supposed to say that. Everything's it's a judgment. I feel you did a good job.
Thank you, Heather.
Anybody else think of anything else they would think was very relevant when they were going to come to sampling for a review? All right. Feel free to put it in the chat or raise your hand later. I will share my screen again and we will keep going. So what Sarah said is also what I've used most of the time: thick or rich data conceptually, or thick description of context setting, relevant to your research objective, and varied populations, context, geographical areas, whatever fits for your question. So I've just made a quick list. This is not exhaustive, but things to think through when you're choosing your sampling strategy. And just as we said, sampling within a QES engages with the same principles used for sampling for primary qualitative research. So think through, if you were doing primary study on this topic, how would you go about making sure you had a broad and rich sample? So identify characteristics or variables that are most important to your research objective or your review objective, and where diversity is known to exist. So different populations, different settings, different geographic areas, different interventions, different types of evaluations, different treatments, anything that could provide variation to your question that you want to cover. And then studies with conceptually rich or contextually thick data are, I feel, very important, because this is going to give you the ability to really have a good amount of data for your synthesis. And Sarah and I are working on a paper there that will come out, I don't know, whenever we're finished it, hopefully by the end of the year. So in the new Cochrane Handbook chapter, there's a massive table with tons of different ways to sample, descriptions of them, applications, and different examples from different QES that have used them. I would say the most used that I've seen so far is this maximum variation sampling that we've sort of been touching on now. So how can you get the most variation in your included studies to best answer your review question from different perspectives? There are lots of other ways to sample. Theory-based sampling, so if you're looking at a theoretical question, or you really want sort of feminist theory, Marxist theory, different perspectives into your review, is another way. So this table, an extended version of this table will be available online once the handbook is published, and a more limited version is available in the handbook chapter, which will be coming shortly. And a lot of this is taken from some articles that I'll show references to later on, but just to really open your mind to, there's lots of different ways of doing this. But today we're focusing more on the sort of variation sampling, or how to get broad data that answers your question, because for the most part, Cochrane reviews are mostly global or across a lot of different countries and often different interventions. So I'm going to talk a bit now about how to develop a sampling frame, and this is one way of getting sort of maximum variation of inclusion of studies, but that still give you rich data. And I'm going to do 2 worked examples here. But some things to consider, and this paper wasn't published yet when I did my 2 sampling frames I'm going to present, but the retreat factors that Andrew and Jane and their team here identified can also really be taken into consideration when you're developing a sampling frame. So if you haven't read this paper, I highly recommend it. It helps you decide which synthesis approach works best for your question, which is very helpful, and helps you think through the different factors that are relevant to your systematic review. So you want to identify characteristics or variables that are most important to the research objective of your review. And as I said, identify areas where diversity exists. So populations, interventions, geography, types of communication, whatever you're looking at. And then I feel it's also important to identify studies with conceptually rich or thick data. It really depends on I guess what type of synthesis you're doing. If you were doing a thematic synthesis or a framework synthesis, the thin data can still contribute. And that's fine if you just want descriptive findings, but if you're trying to do anything more conceptual or go more in depth, then you really need rich and thick primary studies to get you there. And then what I recommend you do, or what I have done, is prioritize these characteristics or variables into an order for your sampling frame. So Sarah was saying for their review on childhood vaccination, conceptually rich studies were the most important. So that was their first priority, right? And then they wanted studies that would answer their review objectives. So that was the second priority. And the third priority was the sort of spread across different settings. So try and prioritize these. So I'm going to present 2 examples of work that I've done just as examples. I think what's important to mention is that once you have, this is coming from a comprehensive screening and study selection approach, once you have identified all of your full text studies that meet your inclusion, you do need to do a mapping of these studies based on your sampling frame. And this kind of equates to your descriptive data collection. So where were they set? What's the context? Who's the population? Some sort of data richness assessment, potentially, anything around interventions. So the descriptive study selection should be done, and then that will help you then do the sampling afterwards. So the first worked example is from my first QES, which was published in 2017. And we had the review objective to look at parents and informal caregivers' views and experiences with communication about childhood vaccination and the manner in which it's communicated. And then also a follow-on to that, the influence that the vaccination communication had on their decisions regarding childhood vaccination. And we included studies that were obviously qualitative, but had parents and informal caregivers as the participants, and talked about information about vaccination for children up to 6 years and any setting globally where this information was communicated or distributed. So from there, we developed a sampling frame, and we had, I can't remember, high 70s or low 80s number of studies that met our inclusion criteria, which was just too much. Because this QES was going into WHO AFRO guidance on how to communicate about vaccination and a larger project that was focused on LMIC settings, We found that the majority of research was taking place in high income settings, and we really wanted to make sure that every single LMIC setting study was included. So that was our first sampling step, was all studies from LMIC settings were included in the synthesis into the sample. And then I developed a data richness scale where we looked at the richness and thickness of the data in the included studies. And we, I can talk more about that later. We are working on a paper about that. So we included all articles that scored a 3 or higher for data richness, and a 3 was basically sort of a fairly good qualitative journal article that was purely qualitative. So we were leaving out mixed method studies with open survey questions. We were leaving out really thin articles and trying to bring in richer data. And then we sampled those in, and then we looked at the remaining studies and saw if there was anything from a high income country that scored lower than a 3 for data richness, but where the primary study question very closely matched our review objective. And here we included a couple of more studies that had thinner data, but where the authors of the primary study were looking exactly at our question: how is information communicated and how do parents feel about that information? So although the data was thinner, it was directly relevant to our review objective. So that was the first time we did this, and we thought it worked really well. The peer reviewers agreed with our approach. They thought it worked well. We felt we kind of ironed out the kinks. So then we got an order from the WHO to work on a QES for perceptions of mHealth interventions for a guidelines process they were running, which was global. So we thought, let's do this again. It worked really well. This is a massive field. As you'll see, our review objective was very broad. So let's try doing a sampling frame again. So the review objective was to explore clients' perceptions and experiences of targeted digital communication via mobile device on topics related to, and this was the large part, reproductive, maternal, newborn, child, or adolescent health. So adults, babies, teenagers, across a large variety of topics. We wanted clients' perceptions of these digital interventions within the broad amount of areas that the WHO wanted, and it was global. So this was really a very large review. So what did we do? We divided the studies. So we did a comprehensive screen. We found everything that met our inclusion criteria. Because we had these different client groups, we needed to see how things balanced out. So the first step we did is that we sort of divvied out all of these studies into the different client groups as listed in the inclusion criteria. And some of them had some overlap, but we tried to sort of divvy them out. And there were a very limited number of included studies for pregnant and postpartum women and for pregnant and pregnant and postpartum women living with HIV. So those were 2 separate groups that WHO wanted included. So we just included all of the studies for those 2 client groups. Then we assessed the included studies within each client group for data richness using a scale of 1 to 5. But as part of this process, we adjusted the previous data richness scale so that the third step in the previous sampling review, closeness to review objective, was brought into the data richness scale. So we're looking at the amount of thick and rich data that was relevant to our review objective. And so we then sampled in studies with thick and rich data and did not sample in studies with thin data or that didn't have a close match to our review objective. So this was kind of a 2-step process where we sampled by client group first, and then for client groups where we had a lot of studies, we did the next sampling step of the data richness. And we didn't do sampling based on geography here because we actually found a really good spread of studies from all geographic locations. So we didn't feel that that was as big of an issue as it was for the vaccine review. We had a good number of studies from broad settings. So the question we get a lot is when to stop sampling. How many studies are enough? And there's no clear guidance or arbitrary number for when to stop. So it's the same as when you're conducting interviews or focus groups. You stop when you feel there's no new data coming up. You stop when you don't have any more time. You stop pragmatically because you feel you have enough data to work with. So there's no sort of number. I can't say 25 studies is enough. You really need to see what the data is that you have. Stopping also depends on the same retreat motivated factors as sampling. So that paper I mentioned before, and these include the richness or thickness of the data you have, the breadth of contexts or populations, the amount of data, how you're going to analyze the data. So again, a thematic synthesis versus a meta-ethnography, you need different types of data, and also the experience of the review team. So if you have a very inexperienced review team, you may want to include fewer studies in order to have enough time to do the synthesis. Whereas if you have a very experienced review team with experienced qualitative researchers who've done a number of QES, then maybe you could think about including a larger number of studies. You can also consider things like theoretical saturation, which Sarah did, or you can sample in a bunch of studies, do your synthesis, and then one thing we're wanting to try, we haven't had time to do yet, is then go back and sample further for findings where your grade circle assessments are not moderate or high. So where you have low or very low confidence due to the amount of data you have. So that's another option. Reporting. So when you're sampling, just like anything else you do in a systematic review, you have to report what you've done clear and transparently. And when I think about reporting, I always think, am I writing this in a way that another team could pick up my review and pick up my primary studies and be able to replicate what I've done? So what's really important in a QES is that you report your procedure. So that's what we refer to as your audit trail. So what you did. But in a QES, it's also really important that you're reporting the rationale behind your decisions and a clear explanation of your choices. So this brings us back also to reflexivity. So why you did what you did, the rationale behind it. So your decision trail. So for example, in the vaccine review, we made the decision based on representation to include all LMIC studies as the first step of sampling because we needed global representation. We could have done it a different way, but we had to explain our choices. And then remember, if you do sample, you have to provide 3 lists of studies at the end of your review, not just 2. So you need to provide a list of excluded studies at full text. You need to provide a list of included studies at full text, and then you need to provide the list of sampled studies. So you get 3 citation lists, not 2, like a normal review. So just to round up, and then we'll take some questions. At the protocol phase, you need to decide how you're going to select your included studies. So are you going to do a comprehensive study selection and then sample if you get too many studies? Or are you going to sample using a theoretical study selection process? And then think through how you're going to do that. If you've included too many studies, decide which sampling approach best fits your question. And then look at your review objective to determine the most important aspects you want to sample for. So what would help you get the best synthesis, the best data into your synthesis? Or if you have too many included studies, are you better to narrow your inclusion criteria and get rid of studies that way, maybe by publication year or other things, especially if it's a commissioned review? Then you need to map your included studies to gain an overview of what you have, and you should map this based on the factors you've determined are important for sampling and any of the retreat factors you think are important for your review. And then you're going to proceed with your sampling. And again, sampling in itself is a very iterative process. You you kind of go back, and I've presented it as sort of 1, 2, 3, but you do go back and forth between the steps and review what you've included. So you guys will get a copy of this presentation. There's a number of very important resources. The EPOC author guidance on sampling is really good. Myself and Claire and Simon have published on the 2 worked examples I presented today. Our work was based heavily on the Surrey article from 2011, where she talks about a bunch of different ways you can sample for qualitative research synthesis. There's another worked example paper by Benut, which is also interesting to look at. And then coming shortly is chapter 5 on study selection and sampling, which will be in the upcoming Cochrane and Campbell QES handbook. And I think that should be online sometime in the early fall, based on the feedback I'm getting from the editors. So that new handbook is going to be amazing. Now I will open for questions or comments. And before I do that, I just wanted to say thank you, and my email is in the presentation. So that's what I had to present to you guys today. We've got lots of time for questions if people have them. And if not, then you get an extra coffee break, I guess. So Amir, did any questions come in the chat?
Hi there. Yeah, I see Joel asked a question. If you could share an example of data richness scale, of a data richness scale.
Okay, so I don't have it open in front of me. If you go into the paper that I talked about, that I can put it in the chat, the link to the paper, it's open access, so you can access it from anywhere. The data richness scale, or my version of it, is, that's massive font, sorry. I don't know how to change the font, sorry. The data richness scale is available in that paper. And then Sarah, your colleague who has her hand up, also has a different version that's very useful. Go ahead, Sarah.
Yeah, hi, thanks, Emma. I was just going to ask, I don't think you and I have chatted about this, but I'm not sure. But I was wondering if you know of examples, any example where people at the stage of the circling, if people then went back, did some sampling. I suppose I'm asking, we with our child at QES considered that. So particularly like where we had, for example, as relevance, we wanted to up our confidence. We then thought, should we go, and because we did have studies from a whole lot of other settings, but then we weren't quite sure how to do that almost, that then do you just bring it in, sort of, you've then got to do almost a reanalysis and bring that into the findings, and we just couldn't face doing that. But yeah, so I was interested if you know of anyone or an example where they have at that stage done that.
I don't think anybody's done it so far. We had it written into the protocol for the QES I just finished, but we didn't find enough studies to do it, unfortunately. I think where that approach works really well is for QES that are going into guidelines. So like the QES I just did, we didn't have a single high confidence finding, and the majority of our findings were low or very low confidence. So if in that scenario where it is going into a guidelines process, we could have gone back for those specific findings and found other supporting information that could have upped the confidence, then I feel that that would have been the right choice in a guidelines process where decisions were being made on our data. Whereas if you're presenting everything with low or very low confidence, that's really hard to make decisions on. Does that make sense?
Yes, that's a good example.
Yeah. So we're crossing our fingers we get to do it soon, but
yeah. And it will be nice to have an example of that here. Will be very, very helpful.
Yeah.
Thanks, Heather.
Yeah. Any other questions?
I don't see any coming through.
Okay.
Just looking to see if there are any hands that are up. Doesn't look like it.
All right. Well, you have a great resource with Sarah in-house. You can feel free to contact me if you have questions. And yeah, I mean, I think it would be really interesting. Probably I haven't done any theoretical or purposive sampling or screening yet. But I think once one of us finally gets to do a QES with a more theoretical study selection sampling, that could be really interesting to talk about as well. Because we have been basically just following the effect review comprehensive screen. Oh no, we have too much. What do we do? And then we sampled. So I think it would be really interesting as soon as we hear somebody who's taken an opposite approach to look at how that worked as well. So.
Great. Thanks, Heather. I've monitored the chat again, and so doesn't seem to be any further comments or questions.
No.
Yeah. So unless Heather, do you have any last closing remarks?
No, just Andrew Booth talks about this topic as well in the Cochrane webinar series on study selection and sampling. So if you want a more detailed presentation, then you could look at that webinar as well, which is free on Cochrane.
Okay. Thank you very much, Heather. Yeah, so I don't think there are any more questions. We're getting a whole lot of thank yous from the participants. So thank you very much for the very informative presentation and the discussion that we could have around this. And also thank you to all that were able to attend today. It's always lovely having you all here. Just to remember that monitor our Cochrane South Africa YouTube channel and website for the recording of this. If you want any, if you want to go back to some of the information and bits that Heather covered today. And then also please remember to complete the evaluation form, which I've added in the chat. I'm going to add it another time in case it's gone lost with all the chatting activities. Like always, we always value your feedback, and keep monitoring your emails for the next webinar that will be coming up shortly as well. So thanks, guys, I'm going to eat, and thanks again, Heather.
Yeah, feel free to email if there's any other questions that come later. So.
Okay, thanks, Heather, and thank you, everyone. Have a good day further.
Bye.
Thanks. Bye.